Hi there, my name is Zach Brandon. I'm an occupational therapist and I work in the Children's Eating Disorder Service in Northampton. I'm going to talk for a little bit about how sensory processing can impact on our child and their eating, talk about what the different senses are and how they might impact. Okay, so first of all, eating is a very complex multi-sensory experience that involves much more than just taste buds. Okay. The other sensory systems that are involved are our tactile system, so how we register touch, our visual system, so what do we see in front of us when we see the food, the smell of the food itself, that will impact on how a child perceives food. Hearing can also impact on eating, particularly if a child is particularly sensitive to certain sounds or even gets upset or irritated or disgusted by the sounds of chewing, swallowing and things like that. There's two other senses that are involved that are probably less familiar to people. One is proprioception. Proprioception is a sense of our body and muscle movement. So obviously if we're chewing, swallowing and moving our tongue around, that's lots of different muscle movements. So I will talk about that in a little bit. And the other sense that gets very much involved more after eating or before eating is our interoception sense. That is the sense inside the body that tells us if we are hungry, if we are full. So I was going to talk about what sensory preferences in eating look like, which we might see in young children with ARFID, avoidant restricted food intake disorder, or even those who are just very selective and fussy around their eating. So they may be very particular about the visual presentation of food. They will be very vigilant around the colour of food, if there is colour discrepancies, if there is a change in shape, a change in size, or even a change in the packaging and the presentation of food. And this is very much about if it is inconsistent and doesn't look like it did last time, this food may not be as safe for me, or it might give me a different experience which I find hard to tolerate. They're likely to be very sensitive to variations in taste and flavour, again for the same thing. They're looking for regular, consistent experiences. So if something tastes slightly different, that might mean it's going to affect them slightly differently. They're going to be very sensitive to smells of food. Now that might be their own foods, but very often that is the smells of other people's food. And it can be a little bit overwhelming to them and can provoke sort of feelings of disgust in them. We might also see they're very limited in the range of food textures that they will eat. So they may tend to stick to a certain type of texture, usually possibly drier, usually possibly crunchier. They're less likely to be eating mixed consistencies. So a pasta with vegetables, onions and meat with a sauce. They tend to prefer consistent textures that are, again, very predictable for them and easier to manage in the mouth. In terms of auditory sensations, they might get very distracted by the sounds of eating. So the sounds of chewing and swallowing might provoke some disgust, even their own. So all of these different sensory experiences can impact on a child's ability to eat, willingness to eat, and how they feel about eating. And I'd ask you to consider your own sensory preferences. There must be foods that you probably dislike, and they're very likely going to be down to the sensory qualities, whether they're too slimy, too dry, we don't like how they feel in the mouth, or the experience of swallowing them is particularly awful, or we hate the flavour or the smell. So we all have our sensory preferences that guide our food choices. However, with young children, they may be more severe, more intense, and which lead to a more restricted range of foods. So I'm going to talk a little bit about just an overview of sensory processing, what it is. It's a very big area and we do not have time to go into all of it today. So broadly speaking, sensory processing is the way our brain organises and interprets all the information from our body and from the environment. So the brain will integrate these different sensory inputs to create a more coherent view of the world. This allows us to respond and interact effectively with our surroundings. Okay, so everything we know about the world comes through those senses, and how we interpret them determines how we respond to them. Sometimes we can respond in a helpful way, sometimes our response could be unhelpful to us. So sensory processing is essential for almost every activity we perform. It be from a simple task like picking up a cup to an even more complex task like driving or riding a bike. All of these actions and activities we do involve us being able to manage and understand our sensory inputs. So broadly speaking, again, with the children that we work with, we can see that some can be very hypersensitive to sensory stimulation, so they have a bigger response than normal. Some people can be very under-responsive, so they're less sensitive to some sensory stimulation, and that will depend on the situation. It depends on the child. A child might be hypersensitive to some, under-responsive or under-sensitive to others. There's no set rules around this. But broadly speaking, our sensory systems, and certainly when we're looking at eating, work on the concept of excitation and habituation, and I'm going to speak about that in a little bit. Okay, so I spoke at the last slide that a lot of things that are involved with sensory processing and eating is the concept of excitation and habituation. So excitation is basically how our body registers a sensation. Okay, so we are responding to sensations every day, every minute, every second of our lives. We're responding to sound, to the feeling of clothes against our skin, to the noises that we hear about it, to the feeling of the saliva in our mouth, the taste, the smells, everything, every day, all day can cause excitation. Now, if we are to constantly respond to all of these different inputs, it would be almost impossible to function, maintain attention, and just carry on normal daily life. So our body then has to habituate, which basically means getting used to a sensation over time. Okay. So excitation is when we register the sensation. So in terms of eating, we might register more if there is a change in texture, say of a chicken nugget that a child normally eats, or if they've changed the flavoring slightly, or if it's been cooked a bit longer than normal or a bit less long than normal. This causes an increase in attention, so can increase anxiety, can increase alertness and vigilance to the change. So again, we need excitation, because if there's a loud bang outside, we might need to be aware, register that so we can respond to it. Okay, as I said, if we keep responding, then it can make it very hard to get used to that sensation. We're always going to have a more hypervigilant response. So what we want the body to do, and what usually happens, is something called habituation. And this is essentially getting used to a sensation over time. So an example might be a ticking clock in a room that you initially would register a lot. It might be irritating, it might bother us. Over time, our body would habituate to that sensation. We would no longer notice the ticking of a clock. In terms of eating, we might introduce a new food. So again, the chicken nugget that's got a slight change in texture. Over time, the child may get used to the feel of that change in texture and habituate, and just it no longer becomes as alerting. They no longer become as vigilant to those changes. Okay, so that is the main thing that usually impacts the child with the eating from a sensory perspective. They are registering more than normal changes to texture, smell, and all the various sensations that I've discussed earlier. So I'm just going to go over some of the senses that we have and how they are going to impact, considering all the other things I've talked about: excitation, habituation. So in terms of our visual sense, as we know, this can greatly influence our willingness to eat. If something looks unpleasant, unappealing, and this might be down to the shape, perceived texture, the colour, may indicate the food is different, and we may experience an aversive experience, which a child would not like. So very often children, if having to experience new foods, will tend to look at it in great detail because they're trying to determine if it is consistent in terms of texture, shape, colour, all those things that might influence them. Smell is also another key to taste and eating experience. You might see your child will look at food and expect it greatly first of all. The next thing is they're probably going to smell it. Because again, this allows them to detect if there is smells that maybe enhance the flavours or may provoke feelings of disgust. It might be that the smells are unfamiliar or inconsistent from last time. So again, they are trying to test and judge how safe and consistent this food is going to be based on their previous experiences. So in terms of taste, we know the tongue's got lots of receptors on it that allow various flavours. So again, the key thing is when a child might be trying a new food for the first time and they've done the visual test, it looks okay, it doesn't look like it may hurt them, they've smelt it and there's nothing particularly aversive, they might then want to test it. What might happen first of all is just a lick test. So that is going to allow them to determine how strong the flavour is. Is it particularly aversive? Is it going to excite them more than they like? Are they going to register it too strongly? Okay, so what we might see is children might like the taste, but then there might be a change to the flavour or how it's cooked that might impact on that taste. So it is now different, and that means I can't tolerate it because it is no longer consistent to what it was before. We also see this with textures or the tactile sense. So the tactile sense in the mouth is anything that touches our lips, tongue, gums, and the cheeks. Okay, the tongue has a lot of tactile receptors, so lets it know how something feels or the temperature or the actual texture. So again, young people might be very vigilant to the texture. As they chew it, the texture is going to change. It is going to be less solid and less consistent. So children may find that harder to swallow or more unpleasant to swallow because it is now lacking consistency. So the role of texture in food is really important about how they register this input. For the final two sensations that are involved with eating, we're going to talk about proprioception. So proprioception is basically our muscle sense. It allows us to know if our muscles are contracted, extending, where our body is in space. So proprioception would allow me to close my eyes and touch my finger to my nose without seeing them because I'm getting feedback from where all my muscles are, where my body is. So this happens with chewing and swallowing. There is lots of muscle movement through the jaw. There is lots of muscle movement through the tongue. So if we're not getting good proprioceptive feedback when we are moving food around our mouth, that can increase anxiety. We're not sure how to manage this sensation in our mouth. When we're chewing, how do I stop it going down the back of my throat unexpectedly? So proprioception is really important. It's how they move the food around. It's how they make sense of the textures and the movement of the food within the mouth prior to swallowing. If they are more sensitive to movement in the mouth, they might be more anxious about chewing, about how to manage that. It might increase fears of choking or food going down the wrong way. So it's quite important. The final sense I want to talk about is interoception. So interoception is our internal sensations. So interoception can be let us know if we are hungry, if we are thirsty, or if we are full and have eaten enough. So it helps us to regulate food intake, lets us know when to stop. It also can let us feel sensations from our digestive system, such as stomach growling, feeling full. For some people, they might be very sensitive to that sensation, and it can feel quite unpleasant. So we might have children who have eaten, notice the change feeling full or maybe even overly full and perceive that as nausea or an aversive experience. So this may also impact on what they eat, how much they eat, or how they feel about eating as well. So things to consider from a sensory point of view when your child's eating is just the environment itself. Some children who might be quite sensitive to some of the oral eating sensations might be more sensitive as well to auditory sensations as well. So they might find it less easy to eat if it is noisy and overwhelming. If they're quite sensitive to smells anyway, being in an environment that has strong smells may make it harder to eat. So we do need to consider the environment they're eating within and if it helps or hinders their eating. Things to consider about the presentation of the food. Is it consistent? Is it going to look the same? Is it coming in the same bowl? Are they happy with food touching? Are they happy with food not touching? Those kind of things. If we're trying to introduce new foods to a child, it is going to be harder to introduce a food that has bigger jumps in the sensory qualities. So moving from a chicken nugget to a chicken curry is going to have a huge difference in terms of the smells, in terms of the textures, in terms of the taste, in terms of the visual presentation. So if we're looking to support a child to habituate their senses to eating, we probably want to make the gaps between different foods as small as possible so that the sensory differences are as small as possible. Now, this can mean if trying to go from chicken nuggets, it might be going to a different brand of chicken nugget or a different shape of chicken nugget or even a slightly different coating. But they are going to need time to habituate. A child trying new foods is trying foods with all senses. It's an exploration. So the first times we try to introduce the new foods, they may just look at it, and that's fine. That's still trying. They may smell it. They may then lick. They may then take a small nibble. All of these are ways of trying foods because we're trying to get used to all the different sensory qualities. So we need to give them time. We need to not rush them, and we need to acknowledge that it is going to take a while for them to start trusting new foods. Okay, so in summary, what we know is eating is a multisensory experience that involves taste, smell, hearing, proprioception, interoception, and texture. The body works on the process of excitation, so responding to a new sensory sensation, and habituation, which means getting used to that sensation over time. Allowing children to explore in a very graded way and expose them to the sensation takes time. It's going to depend on how they perceive all these different sensations. So if we want to introduce new foods, we want to make it more likely for them to change what they're eating, we need to work with habituation, allowing them to get used to the sensation. That requires reducing pressure. It requires exploring collaboratively with the child what they think they might want to eat. Okay, I hope this has been helpful to you. Thanks a lot. Bye.